A good day to everyone. My name is XIANG, and today I'll be presenting on the effect of neuromobilization on ankle dorsiflexors and plantar flexors strength and balance in elderly individuals. This was a pilot study. Now, a brief introduction. Falls among the elderly population have been increasing in prevalence over the years, affecting their independence in ADL. Most fall cases result in elderly individuals being hospitalized, while some still suffered mild to severe injuries. Risk factors of falls among the elderly population include balance impairments and muscle weakness, which have been attributed to an overall decrease in their mobility status. Now, a brief introduction on neuromobilization. Neuromobilization is a technique that serves to mobilize neural tissue structures by facilitating movement in the interface between the neural structures and their surrounding tissue through slider and tensioner movements to reduce neural tension and improve flexibility. Neuromobilization has also been said to have an influence on muscle strength, with the correlation between neuromuscular adaptation and exercise, in which the increased stimulation of the motor neurons results in more frequent firing of the motor units, resulting in more muscle contraction of the fibers. So, ankle function has been attributed greatly to the elderly individuals' ability to maintain their balance in static standing and during movement, with plantar flexor strength contributing to balance performance. Previous studies on neuromobilization conducted for elderly populations and other populations, such as stroke patients and football players, reported improved muscle strength and balance. So the general objectives of this study was to investigate the effects of neuromobilization on ankle dorsiflexors and plantar flexors strength and balance in elderly individuals with poor balance. Specific objectives would be to examine the effectiveness of neuromobilization on ankle dorsiflexors and plantar flexors strength in elderly individuals, and also to examine the effectiveness of neuromobilization on the dynamic balance in elderly individuals. So the research question is, what is the effect of neuromobilization on ankle dorsiflexors and plantar flexors strength and balance in elderly individuals with poor balance? So the null hypothesis suggested that no significant changes occurred in the strength of dorsiflexors and plantar flexors as well as dynamic balance, whereas the alternative hypothesis suggests a significant increase in the strength of the ankle dorsiflexors and plantar flexors as well as dynamic balance. So the methodology of this study was the ethical approval was obtained from the Faculty of Research and Ethics panel, and the participants were screened for eligibility based on the inclusion and exclusion criteria, and we obtained informed consent from the participants before beginning the study, and the participants were randomly assigned to either experimental or control groups. The baseline measurements were done by research assistants, while the interventions were given to participants by the researcher. So the inclusion criteria are that the elderly participants must be aged 65 years and above. They must be residents at the Mercy Convalescent and Nursing Home, and they must have sufficient mobility for movements involving ankle dorsiflexion and plantar flexion. They must be in good health with no recent surgeries or acute illnesses. They must be able to follow instructions and to comprehend the study procedures. And lastly, they must provide informed consent or have legal consent given by a guardian or family member to participate. Exclusion criteria include the presence of neurological disorders such as Parkinson's disease or stroke, severe musculoskeletal impairments such as advanced osteoarthritis, recent fractures, or severe osteoporosis. Severe cognitive impairments, which limits their ability to understand instructions. If the elderly individuals are currently participating in other physical therapy or balance training programs, or if they are taking any medications that significantly affect their balance, muscle strength, or central nervous system, they would be excluded from the study. Also, any current acute or unstable medical conditions would also exclude the elderly individuals from participating in the study. So the randomization of participants, we use simple randomization or using the Cointus method. And the outcome measures we use for the baseline measurements are the handheld dynamometer, the Commando Echo muscle tester device that we use for assessing the ankle dorsiflexors and plantar flexor strength of the elderly individuals, as well as using dynamic gait index, which is for assessing the dynamic balance of the participants. So this is the data collection flow. So the subjects were screened for eligibility. Subject either achieves the inclusion criteria or the exclusion criteria. After informed consent is obtained, the baseline measurements were gathered, and after that they would be randomly assigned to experimental or control group. Experimental group, they will be given the neuromobilization intervention as well as FAME exercise program, whereas the control group will only have the FAME exercise program. After 2 weeks of intervention, the mid-intervention assessments will be done, and another 2 weeks after that, there will be a post-intervention assessment, so a total of 4 weeks of intervention. And after that, the data collected will be sent for analysis. So the descriptive statistics in this study, continuous and categorical variables. The continuous variables will be analyzed in mean and standard deviation, whereas the categorical variables are analyzed in frequency and percentages. The analysis of the effects of the intervention. For within group differences, we used MANOVA, whereas we used independent t-tests for between group differences. So here are the results for the descriptive statistics. So the mean age of the elderly participants were around 78.64 years, with a standard deviation of 7.35 years. And there were more females than males, males being 9 of them and females being 19. And there were predominantly Chinese participants with 27 of them, whereas only one was Indian. And 27 of them were also right hand dominant, while only one of them was left hand dominant. 25 participants prefer to use their right leg, whereas 3 prefer to use their left leg. So these are the results for the within group and between group differences for the effects of neuromobilization. For ankle muscle strength, which is the dorsiflexors and plantar flexors, as well as dynamic balance, the within group differences, they all had a significance value of less than 0.05, which showed statistically significant differences, whereas between group differences, all the variables also showed a p-value of less than 0.05, which also meant statistically significant differences. So neuromobilization on ankle muscle strength. There were significant improvements reported for ankle muscle strength, which aligns with many previous studies focusing on lower limb strength. However, the previous studies had smaller sample sizes, and some previous studies reported significant improvements in muscle strength, but it was conducted for the upper limb. And then neuromobilization on balance. Significant improvements were also reported for dynamic balance, and these findings also align with most previous studies, which also reported significant improvements in balance. However, these previous studies had smaller sample sizes and shorter study durations, while some other previous studies reported improved balance, but they were not significant, while some others reported no significant improvements. So for this, the null hypothesis was rejected for ankle dorsiflexors and plantar flexor strength, and the alternative hypothesis was supported. And same goes for dynamic balance. The null hypothesis was rejected, while the alternative hypothesis was supported. So the limitations of this study was that there were unequal distribution of male and female participants, and the study population had fewer males to begin with for selection, and there were no anthropomorphic measurements involved, such as the height, weight, and the body mass index. There was a wide age range for the elderly individuals. The study duration, it was only 4 weeks, so which was quite insufficient for observing the long-term effects of applying the intervention. So in the future, study population should be surveyed more methodically beforehand to recruit a sample size with more equal gender distributions, and anthropomorphic measurements should be conducted to recruit more suitable participants and obtain more consistent results. The age range should be narrowed down as well to minimize the large age gaps, which could affect the validity of the findings and a longer study duration. So to conclude, neuromobilization significantly improves both ankle muscle strength in dorsiflexion and plantar flexion and dynamic balance in elderly individuals with poor balance. That is the end of my presentation. Thank you.